Hi, my name is Peyton, and for my mini lecture, I decided to talk about listening. I work at a hospital as a nursing assistant, and listening is one of the most, if not the most important skills that we utilize every single day. In school, we are taught that we are the eyes and the ears of our patient, and listening is one of the ways that we are able to be just that. We listen every single day to our patients and also the care team in which we work with. So that can include the nurses, the doctors, the physical therapist, and so many more. We listen and communicate all the time. So it's very important to understand what listening is. Listening is the way that we select, attend, understand, remember, and respond to the information that is said to us throughout the day. When we select information, we are intentionally focusing and prioritizing what is being said to us, whether that be the patient or our care team that we work with. When we attend, we are concentrating on that selected information and being present with who is speaking to us, making sure we give them our attention. When we are understanding, we're making sense of what is being said to us and making sure we understand fully what they are saying. And that can be very important when talking to a patient and the care team. We want to make sure that we have all the information and understand what is being said to us. When we remember, we are recalling what is being said to us, and that can be important with what the patient is saying because it could be a symptom or a sign that is important to relay on through the care team, or it could be remembering what the care team said to relay on to the patient or to do something that we need to implement and do. So remembering is extremely important, and that can also include the small things. It can be remembering what a patient likes to eat or how they take their coffee, and that can be important in building relationships with your patient because that is one of the most important things, building relationships. So remembering how they take their coffee and bringing it to them can build a good rapport and trust with them. Lastly, the way we respond is how we clarify and summarize back to the person speaking what they just said to us, making sure that both sides have a good understanding of what was said and making that opportunity to clarify if something is wrong or summarize what was said so that everyone fully knows what is going on. That also provides reassurance and again, builds a good rapport and trust with the patient because it shows that we listen and remember and are able to reassure them with what was said. There are different listening styles when it comes to listening. There is relational, critical, analytical, and task-oriented. They can all be extremely important in a hospital setting. Relational listening focuses more on building those emotional connections and building that rapport, as I stated before, with a patient and building that trust. And I'd like to talk about nonverbal communication for just a second and how it can play part in relational listening. Nonverbal communication in a hospital setting can include a simple touch to the shoulder, sitting down and making eye contact with the patient. There's so many ways to implement nonverbal communication and build that trust with the patient. A hospital is a very scary situation to be in, and just these little acts of reassurance can go a long way in calming a patient down and building a good relationship with them. Critical listening is more of one that evaluates thoroughly and pays attention to detail and gets all the information before jumping to any conclusions, which can be super important in making diagnoses and getting all the information that is needed to provide the best care. Analytical is the type that questions that data or any inconsistencies and can find and identify errors in what is being said to make sure that the best route is taken through the best, most truthful and correct information, making sure we get everything right. And that can be very important because healthcare, sometimes there's not a lot of room for mistakes. So making sure that everything is right and the inconsistencies and errors are smoothened out before moving forward is super important. And lastly, task-oriented listeners really focus on that high efficiency and they want to get things done. And again, in healthcare is super important because a lot of the time we have a lot of patients and we see a lot of different people and we have a lot of tasks we have to complete. So making sure that we are time efficient and doing our jobs in a timely manner is extremely important. Me, myself, I would think I'm more of a relational listener. I focus on those emotional and relational relationships a lot. I think it's very important in healthcare to have the trust of your patient. And not only the patient, the healthcare team. I think it's important that they trust me and I trust them to have the best care for our patients. Overall, listening is utilized every single day throughout the whole day with so many different people and with the patient, and just overall, listening is the most important thing that we can implement. And I think it's just overall important to our every single day life. And I hope that you learned a little something about listening in healthcare.